financial literacy, and the human condition. Welcome to Financial Fitness with the Money Doctor, Dr. Francis Rahaim.
Do you like this?
I just love that you used belly. We take an x-ray of the belly. I could see it now on the medical charts in school. And what's this part, Alex? That's the belly. I love it. Okay.
We do a hysterosalpingogram, which is
you.
fluoroscopic evaluation of the pelvis, the fallopian tubes.
I just love that you mixed it, that you made it accessible. You know, we do all these medical things, and the belly is very cute. Yes. I can see why you're popular. Yeah. Hi, it's Frances. I just wanted to take a minute to thank you for watching this video. If you're catching us on YouTube, please help us help others by clicking like, subscribe, and all notifications so you don't miss any videos. And check back for the next video. I think you're going to love it. Thanks again. For more information, you can visit us at hugyourmoney.com.
Welcome to Financial Fitness with the Money Doctor, Dr. Francis Rahaim. I'm Jay Dean, and we're very excited for this show.
We are. We have a wonderful guest today. His name is Dr. Alexander Kucherov, and he is double board certified in OBGYN or obstetrics and gynecology.
Welcome back to Financial Fitness. I'm Jay Dean, along with the Money Doctor, Dr. Francis Rahaim, and Dr. Alex. And I noticed I did not call you Dr. Dreamy, but you are very handsome, so it's...
And I thought you were going to escape that with Jay this time.
I watched the whole show, the previous show, you know, so.
Jess was flirting with him.
Well, that's okay.
He had to say, my wife
not
would
okay
appreciate that.
with the missus, but I mean, you know.
That's all right. I think his wife is probably pretty...
it's very nice to, I mean, you're going to talk to a doctor who, you know, and obviously Dr. Alex really cares about this situation, the whole system, you know, and it's, you want to go in there and know that you've got somebody who's going to give you the answers or give you the right, send you in the right direction. You know, This is great. This is great.
So I want to ask you, because, you know, finance is an integral part of this, right? In your experience, do you find that even financial stress itself can, and it's okay if your answer is no, it's fine, you know, but can it influence the emotional or even the physical side of the fertility treatment?
Absolutely, it can. And sometimes it puts people that need fertility treatment in awkward positions about having to make specific decisions about how they want to proceed. You know, specifically, I can think of a couple of my patients right now that are trying to decide, because of their coverage situation, which treatment they want to do, because they might have coverage for this, but not for that. And this is going to be out of pocket, but this is covered, but has a lower chance of success. And the timing that goes into that and the psychological impact of that. Absolutely. Absolutely.
So I wonder when people come to you, if they start out right away talking about how expensive is this going to be, or what's the process like when somebody comes to you and says, we've been trying to have a child and something's not working. You know, they're coming to you for answers. I'm sure you must have a place that you start. Can you talk a little bit about that?
From a financial standpoint?
No, the whole process. But yes, I'm sure you must discuss with them, look, this doesn't have to be super expensive. We're going to start here. These things, I guess what I'm saying is the cost timelines don't always align with the timelines for having the babies. How do you balance that? How do you explain how to balance that, and what kind of help is available to people?
So our goal generally is to help people get pregnant and have a baby like yesterday. Like that's the goal, right? Yeah. Before patients even sit down for a visit with us, we have a whole benefits authorization team that runs their insurance and puts it in the chart. And we have all of the benefits in front of us at the first visit. So I like to actually take the patient through their benefits at the end of the visit to talk about, hey, we ran your insurance. Here's what you have coverage for. This is here, and here's your deductible, and so on and so on. And here's what you met already, because it's all typically quite up to date. But we also have a separate finance and insurance advocate that every patient has that separately reaches out to the patient within a day or two to go over all of that in a little bit more detail. Separate from that person, we have a different authorization team that, once we know what the treatment strategy is going to be, contacts the insurance company to get all the authorizations in place. the point of all this is to try to take as much off the patient's plate as possible so they can focus on the medicine, on the medical care.
Yeah, the reason I asked is because I have seen it in our practice that people are waiting. And sometimes they're waiting until their jobs are better and they can afford things. That's one reason, right? And it's probably very common. And other times they're waiting because they just feel that it will be frightfully expensive and they won't be able to afford to do it. So in your experience, how much do you think affordability affects when or whether couples actually pursue fertility treatment?
I think the fear of the unknown is the biggest challenge. People come into fertility and they don't know how much it's going to cost. It's not usually listed in people's insurance benefits as an example. Like they talk about, you go to your primary doctor, you get a surgery, but the fertility stuff is usually buried really deep.
Yeah.
So we have a whole team that has to call them, physically call them and get and figure out the benefits. So it's not obvious sometimes what people's fertility benefits are. If people are self-pay, that's a little bit easier because we can just send them our table of what all the costs are ahead of time.
Right.
And we do have, as we talked about in the last show, we do have a company that we work with that does financing and fertility loans and helps with egg freezing and embryo freezing and everything else in between.
Yeah.
So in my opinion, the unknown is the challenging part. Once we can say, okay, here's what's covered, here's how much it's going to cost, that actually puts people at ease more than maybe even with if there's numbers involved, what the numbers are. It's like, okay, at least now I know, and I can kind of process that and be able to make the decision about how to move forward.
It's true about everything. I don't know why we would think this would be any different. Everything is always scarier when you don't have the knowledge, when you don't have somebody professional you can ask the questions of, right? And so I think it's common, I think, for people probably, you'll tell me for sure, but to wait longer than they should because of the fear of that cost. And in fact, that can cost them everything, right? I mean, at least freeze your eggs. If you're sure you want, I don't have children, so I'm not saying, hey, I've got 6 kids running around and I love being a mom. It's not that at all. But for people who know they want a family, you know, can you, I don't know that you can tell us what it costs to freeze your eggs. Maybe you can give us a ballpark.
Sure. I mean, it's about $8,000 to do an egg freezing cycle. It's different between different practices in different parts of the country. About $8,000. Most of that goes into the embryology lab for the actual physical process and paying the people that work there to do the whole process of actually freezing the eggs. There's a lot of components to that cost money. There's also there's an anesthesia component to it. That is not free to go to sleep and have the eggs actually retrieved, and all the monitoring and blood work and ultrasounds and all that kind of stuff. That doesn't include medications, and how much medicine you need really depends on what the underlying numbers are and how much of an ovarian response we expect to get. But that's why we do all the testing ahead of time, is to be able to counsel people appropriately about what their expectations should be. And then, of course, see how it goes. And at a certain point, it is dynamic. This is iterative in some ways. You kind of have to see how it goes using a certain approach, and then make modifications to that if they do it in the future. Good.
But if you think of that, like, so to put that into perspective, it's way more than the cost of a latte a day, but it's about 25% of probably the car you're driving, right? So if you think of it in terms of, now I'm really in money doctor mode, right? If you think of it in terms of what your life goals are and what's important to you and making choices, 8,000, I know that can be a ton of money for some people, maybe not so much for other people who thought it would be more expensive, but in most cases, somehow financeable. I hate to say credit card because I absolutely abhor the interest rates credit cards do, but people put more foolish things on credit cards. Disney vacations, $5,000, what minimal, right? I mean, what the heck? You got to think about what is important to you and whether you want to see that as self-insurance. Are you going to pay this money now to protect your ability to have children later? Or are you going to wait? Now, you got to be sure you want a family, right? I mean, you can't be going, well, maybe I'll just freeze my eggs because that's like the hip thing to do, right? You have to say, I know we want a family, but in my case, if clients were sitting in front of me, I might say, okay, financially, It's not looking great right now. If you think you're going to send these kids to college and you're going to be able to feed them, you're not there right now. But let's put it on our radar and start planning financially for the place where you need to be. In the meantime, you're not going to stop aging. And so we don't have the luxury. I say the same thing to people who are retiring. We don't have the luxury of getting this wrong right now. You've got 3 years to retirement. We've got to get it right, right? Or something like that. So I think certainly you've brought something to light for me. I will ask clients more often when they're young about their plans to have a family. And although I'm certainly not here to tell them what to do, this is something I could bring up and say, have you considered that by the time you're financially ready to do this, you might not be physically able to do this? And maybe that means we want to fund this at this point, and there's help available. And that's all I really wanted to do when you and I started talking is, as I said in the first show, I had no idea what the connection would be between the fertility doctor or infertility doctor and the money doctor, but it turned out to be very logical. So I'm sorry, I'm on a soapbox here, but I'm just wanting to empower people to get the information that they need to make the decision and not just say, here's another thing I'm afraid I can't afford.
You bring up such good points, and really the key is that it can be hard to take the first step, just like everything in life and in finance also. If you don't know what is out there and available, it can be almost impossible to take that first step. But luckily, it's very easy to get an appointment with a fertility specialist to talk about it. It's not that hard. It takes basically 2 weeks to get in with us, for example, for a visit. You can do telehealth and get all the information. And if you have insurance, they will cover that first visit for sure. It's part of just like a regular doctor visit.
I love to bring people into the behind the scenes stuff that I probably shouldn't. But what happens on break, what happens before we get in the room here, what happens afterwards sometimes shows up in these shows as fun little asides. And you're having a red letter day there. Can you share the second story with us? Since we've been on the air, two things have happened.
I got the news that a patient of mine who's been working at this for at least a year. She'd been trying to conceive for multiple years, did low-level fertility treatment. It didn't work. We ended up doing IVF, discovered there are some egg quality issues that you would never know if you didn't do IVF because you can't watch the embryos develop inside your body. You can't see what's going to happen. And she had done she had made 3 embryos over the course of multiple IVF cycles. And the first 2, unfortunately, very, very, very early losses. And today she has a positive test from her final embryo, and the number is excellent, and just thrilled for her. Just so excited.
Very exciting. Very exciting. I hope you'll keep us posted on that.
Can I throw something in here too?
Of course, Jay.
None of us obviously have a crystal ball, Doc, but it seems as though, and I know so, the medical industry has seen, and I don't mean to be flippant about this, have made mental health a priority. And you go to your doctor, at least at a certain age, at least at my age, they ask, have you been depressed the past couple of weeks? Do you see any kind of a trend where fertility treatments and the whole process might become more of a priority? And it wouldn't be the entire population, because obviously you're not going to see somebody at 60 to see if they're going to try to have a baby. But you know what I'm saying? Is there a movement, or does the medical industry see that as maybe something to prioritize and help fund?
I really hope so. I think some of it does have to come from the top down. Certainly, there are states that have insurance mandates and so on for fertility treatment. And it's coming more throughout the country, which is really great. In many countries around the world, fertility treatment is funded by the government. And if you meet certain criteria, you can do whatever you need to do, basically, up to a certain limit, and then they won't fund it anymore. You raise a really good point about mental health. We take mental health very seriously here. I see lots and lots of folks who have, mental health issues are very prevalent today regardless, but certainly fertility challenges can exacerbate a lot of mental health issues, as I'm sure you can imagine. So in our practice anyway, we do have counselors and so on to meet with folks. We have anybody that has, unfortunately, like a pregnancy loss in our practice meets with one of our counselors for support in that circumstance, as well as the rest of the team. So we take it very seriously here.
I
Excellent.
do remember one of my doctors asking me more than once as I was getting up to that 35-year-old, my biological clock is ticking like this. I do remember her asking me more than once, are you sure? Are you thinking of having babies because you're healthy, but you ought to be starting to, pull the trigger on that if you're thinking of that. And I always appreciated that she checked in with me about that, but I don't know if everybody does. And it's we've been one simple question. Just bring it up. See if people are if they're thinking it, or if they're thinking like most of us, hey, I'm invincible, I still feel great. I could still have babies. Um, yeah, so I think most people think of infertility, doctor, as IVF. They go straight to IVF, um, in vitro. But what's one surprising option or an advancement, something surprising, if there is something surprising, that families don't usually realize is available?
So before folks get to IVF, you can do often low-level fertility treatments. And actually, the first line treatment for folks that are young and have no obvious issues going on is not to do IVF. It's not usually the first line. It is to do low-level fertility treatments like oral medicine, monitoring, an injection to make sure that the ovulation is happening at the appropriate time, and intrauterine insemination, which is where we take the sperm and spin it down, get rid of all the abnormal sperm. We end up with half a milliliter of the best and the brightest, and put them into the uterus from below. It doesn't hurt or anything like that, is what the patients tell me. And that will more than double the chances of pregnancy for some people in the month. And that's a often very mellow approach. Oral medicine, a visit to the office. I mean, it's not a huge. It can feel like not as much of a burdensome process that for some folks IVF can feel like.
Yeah, Jay had asked me when I said you were coming on as a guest, uh, is this mostly for affluent families? And is that who you see more often? I mean, is it really an uphill struggle to get people to understand that there might be affordable methods?
In our practice, we see really the whole spectrum of income that you can
You do.
imagine.
Oh,
Certainly, affluent folks, but also folks that are not as affluent, and folks that don't have jobs, and anything you can imagine. So we do see that. A lot of it does depend about if they proceed with treatment. Often there is a financial component to it, which is why we do everything we can to help them and make sure they have access to all the resources they can.
yeah.
But we do see the whole spectrum of folks here.
Well,
There
we
was
certainly
a,
hope you're enjoying this as much as we are. This is fascinating stuff. And we have some more time with Dr. Alex coming up. But Francis, can we get your phone number first?
Sure. I'm so surprised we've gone through this time already. 413-773-3333.
That's why I'm watching the clock for you.
Thank you.
As always, you can go to hugyourmoney.com too to get more information. And we will be back with more with Dr. Alex coming right up on Financial Fitness with the Money Doctor, Dr. Francis Ram.
Financial Fitness with the Money Doctor is underwritten by Hug Your Money.
Mission granted, chase your dream.
Hug Your Money, where financial wellness gets personal.
Welcome back to Financial Fitness. I'm Jay Dean, along with the Money Doctor, Dr. Francis Ram, and Dr. Alex.
Dr. Alex Kucherov, thank you for joining us from Illume. I had a lovely woman who worked with me, and she went through 2 times as a surrogate mom while she worked with me. And she said, oh, it's the best thing she ever did. She's maintained relationships with this. Once was a heterosexual couple, once was a gay couple, 2 men. And I think she just loved the process, absolutely loved it. She said she never felt better. She felt like she was really doing something for people. Do you deal with surrogate pregnancies in your practice, and how?
In our practice, absolutely. Gay Parents to Be, the organization, is part of our practice and was founded by our founder, Dr. Mark Leonderis, who's also our medical director. He and one of the other doctors here, Dr. Laura Meyer, see the majority of folks that need surrogacy to build their families, mostly same-sex male couples who need both donor eggs and a uterus. Very complicated, you can imagine.
Right.
So we do a lot of surrogacy here. Very importantly, the laws have changed, at least in this part of the country. The past couple of years, surrogacy has been legal in Connecticut for a long time, but just recently, the past couple of years, the laws changed in New York State about surrogacy. In the olden days, the 80s, um, it was a little bit different where folks could be the egg donor and also the surrogate. You can imagine that that would create issues at the time of the baby where folks would have a baby and their egg was used to make that baby. And there you can imagine that the challenges that that would present. So nowadays there is always a separation of those things. There is one person that is the egg donor and a separate person that is the surrogate. But yes, we do a lot of surrogacy here. And I've had folks that have used surrogates as well in my practice.
I think it's great, but you brought to mind the strangest thing about Cecil Jacobson. You know who I mean, Cecil Jacobson? Cecil Jacobson used his own sperm without disclosing it to impregnate his patients. So you really want to, if you're going to look into this, you really want somebody reputable. Yeah, it was a long time ago, but you want ethics and transparency. You shouldn't have reminded me of that, but you did. And you know what else you reminded me of was Louise Brown, 1978, test tube baby, right? So uh, I don't know. I have too many questions, but I just want to go back for a minute to the people that you see. I guess out of curiosity, I just wonder if you could change something about the funding part, right? If you could change one thing about how fertility services are funded or covered in the United States, and we can talk about what happens in other countries too, what would it be? Maybe the answer is obvious, maybe not.
I mean, to me, the obvious answer is that public insurance should cover fertility testing and treatment. I think there's no question that that's the most important thing and the next big thing that has to happen in this country. We certainly Medicaid programs in New York and in Connecticut do not cover often don't cover even a fertility like visit or checkup, and certainly don't cover any fertility treatment. Now, there are I'm sure the powers that be that have run the numbers on this, and we'll see what the numbers show. But from a medical standpoint, this is, fertility treatment is really the only thing that if you have a fertility medical diagnosis, you cannot get access to care under certain circumstances. There's nothing else medically in this country that you can't do. Like if you have appendicitis and you go to the hospital, it doesn't matter what's going on. You're getting your appendix out or getting antibiotics. Like they're going to make that clinical decision and move forward. It doesn't matter what your status is.
Mm.
If you have cancer, you can get chemotherapy or whatever you need. Like it'll get figured out.
Yeah.
Fertility is the one thing that's not like that. And you can have fertility issues through no fault of your own,
Right.
and you can still have no access to care because of that. It's
Yeah.
very challenging and annoying.
Are there areas where the U.S., I might know the answer to this question too, but are there areas where the U.S. lags other countries about making fertility affordable and accessible?
In
Fertility
many
treatment.
other countries, yeah, in many other countries, fertility treatment, even if you're paying out of pocket, is way less expensive. Now, the primary reason for that is that there is government funding, even for folks that are using private payments to pay for fertility services. The labs and the practices still receive money from the government. So, classic example, and you might hear about this, people going to Europe to freeze their eggs.
I was just going to ask that actually. Yep.
People do that. And I've heard lots of stories about it. I've had
Yeah.
patients that have done it. I had a patient who froze her eggs in Denmark, and had her donor sperm actually in Denmark and wanted to ship everything over to us. And unfortunately, we couldn't accept it. There's lots of issues with sending gametes between countries. You can
You
imagine
think? You
getting
can't send a plant between countries.
so in many other countries, it can be less expensive, whereas, certainly in this country, we have no support like that, so things are necessarily more expensive. Now we have high standards for our labs here, just like they do in Europe. And to keep those standards high, sometimes it is expensive. It does cost money.
Yeah. Are you seeing more and more employers offering this fertility coverage as part of a workplace benefit? I ask because we're now a workplace benefit, right? And I'm I'm heartened by the fact that employers actually seem to care more and more about their employees. There's a bottom line to it, right? They care about keeping people, they care about attracting talent, they care about that. But I think, we used to see corporate heads as, bottom line number crunchers. And I'm finding that no, they actually want to do good things for their people.
I
So
think
are you seeing it with fertility coverage?
we're absolutely seeing it more,
You are.
certainly than we used to, 5, 10 years ago. Many insurance companies, as part of their fertility, as part of their insurance package, will cover fertility treatment. Even more so, some of the larger companies, for instance, tech companies, international companies, law firms, and finance companies, sometimes they have what are called third-party carve-outs for fertility coverage.
Yeah.
So these are companies that are separate from the insurance company that cover that take ownership of the fertility treatment process. And in many cases, those will also cover elective fertility preservation, so egg
Mm.
freezing and so on. And that is a really amazing benefit that type of stuff certainly did not exist in the recent past. And it's an amazing benefit that many folks do have access to that they did not in the past.
And that they might not know about.
They might not know about.
They really need to ask. And they need to maybe not just ask their HR person, but actually call the company and dig in and find out, or get an advocate to help you at some place like a Loom or.
This is a tough question. I don't know if you'll be able to really. You're great with answers, but I don't know if I'm asking you something that you won't be able to expound on. How do you balance best medical practice with what's realistically affordable for a couple or an individual?
So it really is personalized, and based on their specific situation. For example, if someone comes to see us and the female testing is all normal and the sperm numbers are very low, they might, and IVF really is really the only way to proceed, and they feel that they can't afford it. They say, well, but maybe we can try IUI. That costs, a tenth of what IVF costs,
Right.
generally.
Right.
But if the success rate is like 1%, that's hard to put through. Now you might be cynical and say, hey, you should just do it and you can try it and that's fine. And if they have coverage for it and they want to give it a try and it's not a 0% chance of working, it's fair to do that, right? Everybody deserves a chance, I would say. But certainly if they were paying out of pocket or didn't have coverage for it, I am always open and honest with people about what their chances of success are with any given method and approach based on the best available evidence and research. And in some cases, I would recommend people not do certain treatments. It might be a waste of money, honestly. In the chance of success is so low and not appreciably higher than just trying on your own. It might not be worth the investment, let's say.
Yeah. Well, you did give us a great answer. I really appreciate that.
Going back to the previous show, Doc, it's again, just for me, it's just a matter of here's something else miraculous. Although if you're having some sort of an organ transplant, there's always a chance that something can be rejected. But
Yeah.
I think I remember you saying that eggs, generally speaking, there's little or no rejection.
So it's rare to have a situation where the body itself is, in quotes, rejecting a pregnancy. Not to say that folks that are going through a pregnancy loss don't feel that way, because that is actually the most common way to feel is like, what did I do wrong? Why am I having a pregnancy loss? Why am I having a negative test all the time?
Yeah.
Putting it on themselves, whereas usually it is something else actually about the embryo itself that is causing that. But the body itself typically, for most folks, is not not rejecting, in quotes, a pregnancy. Now, there are certain circumstances where people have things going on that might increase the risk of pregnancy loss. For instance, hypercoagulability disorders, thyroid disorders, various other medical things that can certainly lead to those increased risks. And those can be addressed medically, medications, etc. But as a general rule, there are not usually things going on with the body that will outright reject a pregnancy.
I did find that fascinating because if you implanted just about anything else into your body, your body would say, "Hey, that's foreign. That's not mine." And I also found fascinating that you talked about when one woman in a same-sex couple, if one woman is carrying the embryo as a vessel, that she might think she's just like, a flower vase, right? But you didn't use that term, but I am. But in fact, she's actually contributing something to that embryo. Can you talk a little bit about that?
Yes, absolutely. I mean, beyond the obvious, being pregnant for 9 months and then having a delivery experience, which is a lot, of course.
Yes.
Being a mom, amazing. Yes, the body does direct traffic for development of embryos and the placenta. The uterus tells certain genes in the developing baby to turn on and turn off through a process called methylation, adding hydrogen atoms in a unique way to the DNA, and also through a process called imprinting. This is the same kind of idea. Basically leads to that baby being a unique individual, such that if that embryo was carried by a different person in their uterus, they would alter the DNA in a different way, and that would be a different human being that was born. Amazing.
It is amazing. So I want to thank you again, Dr. Alexander Kucherov, for joining us. To have somebody double board certified, OBGYN, reproductive endocrinology, and infertility from Illum to just peel back the curtain and say, here's what's going on, here's how you can afford things. Your insights really do remind us that fertility care isn't just about science and medicine, but it is about timing and access and making the journey affordable and realistic for families. And so I thank you so much for sharing your expertise with us and giving our followers a clearer picture of both the possibilities and the challenges involved in building a family today.
My pleasure. Thanks for having me.
Doc, thank you very much. Francis, I'm sure people have questions. Can we get your phone number again to pass along to them?
Yes, but I cannot answer any of those medical questions. 413-773-3333.
Or as always, go to hugyourmoney.com. And again, join us next time around for Financial Fitness with the Money Doctor, Dr. Francis Ram.
Financial Fitness with the Money Doctor is underwritten by Hug Your Money.
Mission granted, chase your dream.
Hug Your Money, where financial wellness gets personal. Will you help us spread the word about financial fitness? Please like, subscribe, and choose all. Thank you.